Good morning, and thank you for being here. My name is Marie Molde. I am part of the team here at Datassential, and today I'm really excited to introduce this next interview in our series. Today's chat is with Dr. Hal King. Dr. King is a public health expert. He has spent his career doing things like investigating disease outbreaks with the CDC. He led food safety at Chick-fil-A for several years, and today he has an advisory firm focused on helping the food industry address food safety and public health initiatives. So Hal and I are going to be chatting about food safety and public health as related to COVID-19 and how the industry can best address these needs. So welcome, Hal, and thank you very much for being with us.
Thank you very much for letting me have the opportunity to talk to your colleagues.
Absolutely. I thought one place we might start is COVID-19 is not a foodborne illness like E. coli or salmonella, for example. But that said, there's a lot of fear around it relating to food and, eating out at restaurants. So could you start by sharing your perspective about how it's transmitted and really why there might be so much fear around food and COVID-19?
Sure. Just to give you a little background for context, I used to actually do research on infectious diseases. And so I had research labs at the CDC and worked with the WHO in West Africa on emerging diseases. And I had a background doing infectious disease research at Emory University School of Medicine. So I'm just giving that context so that folks can know that I'm speaking from that knowledge and that experience, not just from a public health side of that. Again, I really am always interested in knowing more about how people could get infected by infectious disease and then how we can prevent them. I think we know that most vaccines that we have are very effective to prevent infections like measles and the flu we get every year. I think the concern in the American public and I think the rest of the world is that this virus seems to be transmitted primarily through aerosol droplets and from surfaces. But because we all eat food and we want food and we know food security is very important, especially in these times, can we continue to feed the population, we have to come in contact with those who actually manufacture and distribute and serve the food. And so the first question always comes, can we get this virus from eating the food? And the answer is no. There's no current, and then people will always say current, public health authorities will always say current because things change based on the knowledge we have about the virus. But right now, as we understand it, it cannot be transmitted from food like a foodborne pathogen can, like norovirus or salmonella. Mm-hmm. But that doesn't mean that it can't be transmitted on packaging that's on food or distribution vehicles or anything you basically would come in contact with by hands, that then you could then transmit the virus from your hands to you, from your respiratory tract into your eyes and your mouth and your nose and things like that. The good news about this, based on what we know about these types of viruses, is that these are kind of tropic to the respiratory system. So just like tuberculosis is only spread from person to person from the air, from aerosol droplets and things like that, tuberculosis won't infect you from inside food, right, if you were to ingest it in food. So we're pretty confident that this virus is a different type of virus, obviously, than the flu virus, which is a different type of virus, but it's not transmitted from person to person through the food.
Mm-hmm. Interesting. So knowing that surfaces are such a big part of it, we see in our data that consumers are really pretty freaked out about objects that are shared touch. So menus or door handles or things. So, I noticed just this morning, I think it was yesterday, the FDA released a best practices checklist for restaurants. And it seems like that is advising some things like plexiglass and masks for employees and gloves. Can you share a bit about your, thoughts on that, or what you think might be the most effective kind of barriers for restaurants to put in place?
Right. So when you have a respiratory virus like this and it's not transmitted through food, it's just transmitted from the aerosol droplets. Again, CDC recommends 6 feet distance, so that you're going to reduce that exposure to someone that may even be asymptomatic and spreading the virus in the air by just talking like I am now. Mm-hmm. But so distance is key. It's very important as a barrier. And that has to be like number one. Can you have people working in an environment that you can keep that 6 foot distance? And because the virus is transmitted, and again, this, if I had to say a percentage, no one will, but if I had to, I'd say probably more than 90% of the transmission is happening from person to person. Like if you and I were sitting here 2 feet apart, I had asymptomatic disease. Probably about 2 days before I actually might get symptoms is when we see the virus titers very high. That's very different than flu. Flu is usually on an hour or two where you see high titer before symptoms. But this is a virus that seems to be transmitted pretty highly from asymptomatic people with mild symptoms. So distance is really, really key. And I keep emphasizing that. So if you can find ways to keep that distance, you can reduce the amount of virus that you might be inhaling from that type of dose. Because we always look at viral infections and bacterial infections as infectious dose, it's really helpful to know what that infectious dose is, right? So how long could I be near someone that has the virus and is maybe asymptomatic? How long could I be near them and actually get the disease where I'd get enough virus in my lungs or in my sinuses that might cause the disease? And right now they're thinking about 10 to 15 to 20 minutes.
Oh,
Where
wow.
you think you might be. So a short distance, passing someone for a few seconds, that's not going to probably be enough infectious dose to get you infected.
Mhm.
Don't know for sure, right? Because this virus is so new.
Yeah.
But that's the common knowledge right now, the virus. So the other things, obviously, any barrier in front of that. So any barrier between me and you, plexiglass, anything that would actually reduce that spread of the virus from while I'm talking and it's being shed out of my respiratory tract into the air. If it gets blocked by some type of control like plexiglass, a mask, a mask that even today now, the cloth mask we know that can reduce some of that viral infectious dose, right?
Mhm.
And so the idea that any of those things that we can put up as kind of hurdles to that virus getting into someone else's respiratory tract through breathing would be pretty significant. Then the second part of that is because we know that just from any type of cold flu virus like this, or just a pandemic flu in the future, anything like that, when you touch surfaces where the virus is at, and the virus can survive up to 72 hours on certain types of surfaces. For example, if you were to cough or sit and breathe over a surface for a long time and I had the virus and was spreading it, I could actually spread it all over these surfaces. And then if another person came along and was starting to touch these surfaces that were not disinfected, and then went to touch their eyes or their mouth or nose, anything that kind of got it back into the respiratory tract, right? Then I could actually get infected pretty easily.
Wow.
We don't think that that's a significant amount of transmission because, again, we just don't know. We don't have all the data to show how much of this is happening, but we suspect it is happening. And so the two primary things, distance and the hurdles that keep the barriers in front of transmission between people, whether they are sick or not, and may have symptoms or not, and then that disinfection of those surfaces on a regular basis. And then the third component of that is because of those two events are probably going to occur in real time at such a high number whenever you're around anybody in a workplace, then you always want to have a process of cleaning the hands. Because again, you'll probably see me in the video at some point scratch my face, or it's just human nature.
It's
Gonna
hard
check
not to.
Yeah, we like check to see if we're still here. We're going to touch our face. And then we always say, oh, he touched his face. He shouldn't touch his face. You're right. But because hand washing can be so effective that if I've been working on surfaces or I touch surfaces or lean up against surfaces or touch a package that I've just got delivered to my house, the more important thing than even disinfection is washing those hands and then either using a sanitizer if you can't wash your hands in soap and water after I have touched pretty much anything. So I kind of think about it like pre-op, post-op. Before you go in to operate, you're making sure your hands are perfectly clean, and then when you leave the operating room, you want to make sure they're perfectly clean so you don't want to transmit what you might have touched in the operating room. So it's like when a package or a surface is there, even if the virus is on the surface, and even if I didn't disinfect that surface, as soon as I touched that surface and I went to wash my hands, if I touch my face, my mouth, I basically just shut down the transmission because now it's gone. It still might be on that surface, but it's not going to get on my hands and get in my face when I touch it. So we like to call this breaking the chain of transmission. The chain is kind of like from you to me, and it might be from you to the surface in the restaurant to the package, and then to me as a consumer. But if we both practice ways to break that chain of transmission, first, you clean and wash your hands before you make food, right? And then you're actually disinfecting the surfaces just in case you might have been exposed. You might be wearing a mask while you're at work. You're reducing any infectious dose in that environment. And then by the time I receive it, if I receive it and then immediately wash and clean my hands, throw the packaging away, then we're going to reduce that amount of virus that's actually making that chain, continue to go on.
You know what you say about the kind of exposure for 10 or 15 or 20 minutes to catch the virus? It makes
Mhm.
me wonder, walking is kind of one of the things left available to us at this
Yes,
time. It's like,
running.
and
Mhm.
I've noticed when I've been out in my neighborhood, if I'm walking down the sidewalk and someone starts coming towards me, one or both of us veers to the
Right.
other side of the street, and you just,
And that's good.
you think,
Yeah, I run every day, and there's lots of people that want to be out. I do too. I don't want to sit here, for long periods of time. I need to get exercise. Matter of fact, aerobic exercise can not make you resistant to infection, but helps your lungs be more healthy.
huh,
And so, if you actually exercise and get aerobic breath, it does. There are scientific data that show that exercise and having good aerobic exercise and healthy lungs can make you not resistant to infection, but reduce the risk of infection.
oh
And
wow.
so exercise is really good, but you don't want to exercise, obviously, where you might be getting a lot of exposure to the virus. So absolutely, like when I run and I see a family with their stroller walking down the sidewalk, I just go ahead and get out of the way. I get about 10 feet away and run beside, away from them. Just
Yeah,
out of respect, they don't know who I am or what, and I don't know if they've got it,
yeah.
but that's just kind of how we're going to break this chain of transmission is by doing this kind of things, and
Hmm.
helping each other out, make sure we don't expose each other to it. This morning, the Emerging Infectious Disease Journal at CDC published a paper from China. They were showing that a large amount of the virus was actually found in the hospital wards, the ICU, and some of the non high risk patients that had COVID-19 in on the floor. Okay, so we would suspect that the virus could be found on surfaces as we talk, or people are sick and coughing and things like that. But no one's really ever looked at the floor. Well, there was a large amount of virus coming on, laying down after it's been in the air pretty quickly on the floor.
Oh
And
wow.
as a lot of the doctors and nurses would move from taking the mask off and working in that environment and then go downstairs to the pharmacy, they were finding the virus downstairs in the pharmacy on the floor.
Hmm.
So see how easy the virus can transmit itself from surfaces like your shoes and
Yeah.
shoe coverings and things. So we do have to kind of think about whenever we're in a workplace or we're in those environments, where else could it go? And so let's disinfect the floor.
Yeah.
Make sure we don't wear shoes into those environments. Maybe leave them in that environment before we take them home.
Yeah.
Again, I don't think you're going to transmit a lot of virus from the floor, but it just shows you that it can be picked up and moved around. And again, the other caveat to that is this was a hospital ward with large numbers of patients who were sick, coughing with the disease. So they're again high virus, titer, right?
Right.
Probably high infectious dose. Don't know if that's going to happen in a lower type environment, risk where you might have people preparing food, things like that.
That makes me wonder with the being on the floor and how easily it's transmitted. I've heard that those of us who are getting Amazon packages which might be even more common these days than several weeks ago, should leave the packages outside for a day or two before we bring them in our homes, lest there be virus on the package. And that makes me think of restaurants too, who are getting food
Sure.
deliveries. Should there be a protocol in place to disinfect, say, boxes or packaging before you accept it in your operation?
Yeah, my son-in-law. I have two granddaughters with my youngest daughter and my son-in-law, and they just had a new baby boy, and so obviously they're really, really worried to make sure that the children stay well. And I love what he set up to do in his garage. He receives packaging on a table in the garage. They deliver the packages. They stay in the garage. He goes out with gloves, opens up the boxes, breaks the box down, takes the outer pack, and basically disinfects all the packaging that would go inside. Takes the gloves off, the boxes stay out, so it's kind of like a pre-op like, and then whatever goes in has been disinfected to the house. And then when he gets in, he washes his hands again. and then sanitizes or disinfects that product. So in a way, it's a great idea to kind of for folks to, and whether you're being delivered to a food service, whatever, break the boxes down outside. Doesn't mean that we know there's going to be a lot of virus on there. We don't know if there's any virus on there. We
Mhm.
know it can be there, and why not just keep it out there, right? It's
Right.
kind of like what we tell food service. And I don't ever promote one product over another. I'll promote any product that actually saves lives. So vaccines, diagnostics, antibiotics, disinfectants. But if you have a wipe or a paper towel and a disinfectant, it'd be so much better to spray and disinfect with a disposable paper towel and throw that in the trash can or in a bag than to
Mhm.
take a reusable cloth, that might be stored in a bucket of sanitizer, or you might just have a rag and then disinfect with the same rag, because the rag is actually going to inhibit the disinfectant from working on the rag itself. So you might actually be transmitting germs from using reusable towels and rags. So just maybe move to more disposable, towel or paper towel, something inexpensive. And there's a lot of pre-moistened wipes that work that way too. So that you kind of just, again, that same scenario, whatever you're exposed to, keep it away from you, either through keeping it from distance, keeping it from the packaging, disinfecting the surfaces, washing your hands, and making sure it doesn't come into your contact with you.
Hal, do you think any of these new procedures are going to be lasting in food service? Like, do you think when we get through the bulk of this, there's going to be plexiglass between booths where consumers dine, or are employees going to wear masks, or can you see any, I guess, long-term adaptations that we
Mhm.
might implement?
I hope so. I hope so. Not necessarily that we have the plexiglass barriers between people. I
Mhm.
hope that we get to a point where we don't have that worry going out in public of being exposed to these dangerous viruses. Again, does that occur before COVID-19? Yeah, if you remember in California, they were having a measles outbreak. People were getting measles because people stopped getting vaccinated for the measles in some circumstances. And so now, in an environment in a restaurant, you could have gotten someone, a customer could have had measles, and you could be sitting next to that person and get measles if you didn't have vaccination, right?
Mhm. Yeah.
Vaccination basically makes that public place safe, because if you have it and I don't, but I've had a vaccination, I'm not going to get it. So even if you had it and didn't get a vaccination, you can't spread it when people are vaccinated. I don't mean to say that I hope that things stay that way for us with plexiglass and COVID-19. But the fact that Anthony Fauci basically mentioned about not shaking hands, I hope that we don't get to that point. I'm a hugger. I love to like to say hello by hugging them.
Right.
Hey, how you doing? I hope that that's not going to be the future. But
Mhm.
I think the good thing about our future in food safety management will come from a lot of foodborne diseases are spread from this transmission route, where a person comes into the restaurant, they work sick, they have diarrhea, vomiting from norovirus or salmonella, and because they don't practice these personal hygiene practices, hand washing, glove use, and they don't practice this screening the employees for wellness. For example, don't come to work if you're vomiting, have diarrhea, and you've got fever. You don't
Mhm.
need to be working with food. Stay home and then wait until you don't have symptoms and you're all clear. Those are the things we should have already been doing for years in the food service, just to prevent outbreaks of foodborne diseases. And we have thousands of those types of illnesses a year from just that. So
Yeah.
the good thing from this might be, I hope, that now that we've all kind of gotten sensitized to doing wellness checks for COVID-19, screening our employees for, are you sick with fever? Do you feel feverish? Have you been coughing? Have you had shortness of breath? But also diarrhea, fever, jaundice, those other things that screen them for foodborne illnesses. But maybe together, as the pandemic virus goes away and we can get control over it, maybe we actually see foodborne disease illnesses go down too, because then we're doing the same things that would actually reduce and prevent those as well.
Well, and Hal, we're getting a lot of questions from our manufacturer customers
Mhm.
and distributors as well, that, a lot of this is on the shoulders of restaurants right now. They're the ones
Sure.
serving the guests, so they really need to make a lot of change in this
Right.
environment. Can you think of any best practices, ways that manufacturers or distributors might best support their restaurant operator customers?
Yeah, I think, first, thanks. We want to say thanks. I think we all feel this way. Thank you so much for them all continuing to work. A lot of us would be afraid to go into the workplace sometimes when we hear there's a high transmission of virus, like downtown, New York and areas in New York, things like that. So the fact that they just get up and go to work every day and work in their food manufacturing jobs, I think is heroic. And we really, really appreciate all the efforts they're making to keep the food supply chain moving and keeping the food coming, especially the restaurant operators too. The restaurants that are trying to struggle with low sales, but still keep the restaurants open because people do want to eat restaurants and like whether it's delivery or pickup, we all see restaurants as a way for us to have community.
Yeah.
So we meet and have dinners with our families and our friends and all this, and or go have a cup of coffee or something. So really, really appreciate all they're doing in the industry to keep the food going because it's just part of our society. But I think some of the things I've thought about and seen them do is try to start more doing accommodating that delivery process so that there's, like we talked about before, there's less kind of exposure, close contact in the delivery process. There's probably a different way to maybe package food. Maybe we rethink the way we do cardboard boxes. Maybe we just rethink the way and it might help us with the environment too. We reduce trash and waste and things like that. I think a lot of folks, because preparing food is going to obviously be a challenge in dining in. It might be that food manufacturers start to make more ready-to-eat type or ready-to-go type foods that have less labor cost and are able to kind of come right into the food service establishments and be open and used or served.
Yeah.
Anything that's related to trying to reduce, again, I think this is the new normal. I think we're going to deal with this for a while. And this isn't really even as bad as this really isn't the worst that it could be. The worst one could be a pandemic flu where millions are dying, every month around the world. And we don't want that to happen either. So I think a lot of the distribution and the manufacturing folks are going to be rethinking package design, maybe more touchless deliveries, less contact type deliveries. I think in the food service environment, you're probably going to see a lot more, and some are already innovating in that area, where there's touchless contact type, exposure between that interaction with the customer and the employee.
Mm-hmm.
I think the other thing I think a lot about is in the food manufacturing environment. There's a lot of food manufacturing environments that are built around high throughput for the food production it needs that are going to probably have to rethink about protection of the employee in those kind of environments. And the good news is that a lot of them, before they go in and handle food, are wearing masks and wearing boots and removable aprons and things that get washed and sanitized before they go inside the food prep area in food manufacturing. So they're doing a lot of the practices already that reduce significantly the potential of the employees being exposed between each other and the packaging.
Yeah, we saw in our ongoing research with consumers that safety was, the biggest fear for a long time, and it went up and up and up in all these past weeks, and it's finally leveled out a bit. And I think it's 60% of consumers say that they feel like they'll feel safe eating in a restaurant again in 2 to 3 months.
Yeah.
Does that sound reasonable to you? Do you have any thoughts on timeline?
I think it does sound reasonable from the consumer perception because I'm a consumer.
Mm-hmm.
I can't wait to go to one of my local restaurants and sit down at the bar and have dinner with somebody and talk. And, that's just where you like to get out of the house,
Yeah.
go out to eat, meet friends, do this type of thing. So we're all kind of optimistic that we're going to get to do that. And we're expecting public health and medicine and the science and all those folks to fix this so that we can.
Yeah.
So I think that probably comes from just everybody's kind of pretty positive that someone can figure this out in the United States, at least in our areas where we actually work in the medicine, science, and all that we will be allowed to do that. So, and I think people look at that from the long term might be the vaccine, the short term might be we've got medicines to treat us. And I think the 3-month kind of where you're seeing people think 3-month is that we're going to be able to kind of tell who's been exposed, right, for maybe an antibody test. We might be able to go find that people were exposed and didn't get disease, but they're no longer infectious and they no longer can get infected.
Mm-hmm.
They're going to see that optimism. Okay, well, I can't infect anyone and I can't be infected, so I can go, right? And then I get on the Instagram or anywhere else and go, how many of you guys are out there? Meet me at Trinici's, at the restaurant. I think that's where you get that. People just are, they want to be together, see each other and stuff. And we're just that kind of, that's who we are. So I think that's where that optimism comes back and that they'll figure it out.
Yeah, I believe that too. Lead with optimism.
That's right.
We'll go there. We developed a very valuable app, which launched, I believe, recently for the industry. So could you share with us a bit about what's there and how you can access it and how folks can use it?
And we developed an app called Emergiprotect that actually has some systems built in it for them that will allow them to do two of the most important things right now in the pandemic coronavirus outbreak is to be able to screen your employees before they come to work and then when they're at work at each shift for their wellness, right? You're going to check signs and symptoms of disease. And again, trying to remember each one to ask and how to ask. And then if someone says they've got fever, well, what do I do? And so we designed this app to help them do that process of screening for wellness and then telling them what to do. It's based on all the guidelines that are updated every day by the CDC. So if the CDC changes the guideline and says, yesterday the guideline might have been if an employee says they live with someone that tested positive, you have to exclude them and send them home. Whereas today, now the guidance is because they're critical infrastructure, preparing food is a national critical infrastructure business, then the CDC would allow that person to wear a mask while they're at work, even though they might have been exposed to someone that tested positive. Now, certainly not if the person's sick and has symptoms and they continue to get screened. So see how that changes with such a short period of time. And so we designed this app called Emergiprotect to help update that on a regular basis to help the industry be able to apply those new guidances in their wellness check. And the other important part is the disinfection, right? We all know, we hear all the time, we need to clean and disinfect high-touch surfaces. Well, first, what are those high-touch surfaces? You need to define them. But then how do I clean and disinfect? Most of the restaurant industry knows how to clean and sanitize, but they're not aware of the concept of a difference between sanitizing and disinfecting. Now, disinfecting is pretty easy if you're just talking about COVID-19. There are disinfectants on a list that EPA provides, and there's ways you can check yours, if you have one already, to see if it will kill the virus. That's kind of really key, but most people don't know where to go look for that. They don't know how to check it. So Emergiprotect kind of helps them get to that information. Is yours a disinfectant that will work? How do I use that disinfectant? And just kind of helping them understand the difference between sanitizing and disinfecting surfaces. And then there's also a criteria for when you disinfect, right? So over here, if you do a wellness check and in your case, let's say we check you and we ask you, do you have any symptoms? You go, yeah, I had a fever this morning. I'm having trouble breathing. Then I say, well, Marie, you need to go home. You're going to need to self-quarantine for 14 days. You might want to call your doctor, go through the process. Well, as soon as I exclude you and you go home, I need to take a corrective action. And now because you've got symptoms, you potentially have just exposed a lot of surfaces, much higher probability than if you were asymptomatic, but still could be the same. So we're going to actually, as soon as we exclude you, take a corrective action, disinfect surfaces right now as you're leaving. And then give you information about how you, and then also let you know when I can put you back on the schedule. Because another critical issue, and we recommend using a sick log to track employees, is if we got the schedule ready for next week and I've got 30 employees I need to schedule based on their hours at work, I don't want to accidentally schedule Marie to come in and work when I just sent her home when another manager just sent her home 2 days ago. So we need a record that shows that you were sent home, you're on the sick leave, when can you come back and be rescheduled? And so we recommend and help them do that through the process of this app. It's available on both the Apple Store, so Apple Store and the Google Play Store. It's updated in real time. We have a native code system that updates in real time. And it's available for free. It's been sponsored by Perel, our partners who have helped us with a lot of projects, and they're helping us keep it updated and sponsor the app.
That's amazing. What a great resource. I can say I was looking at it yesterday, and it's such a beautiful design too, and just easy to navigate. And that will be so helpful for the industry.
Yeah, I think it came from when I worked in food service in a chain. I remember when we started asking, we had certain types of emergencies like a power outage, and people with restaurant franchisees would call and they say, well, what do I do? And you're going through the steps. Here's what you need to do. Well, where's that at? Well, it's in a manual. Where's the manual? Oh, it's over here in the office. And then go get the manual and you open it up. What's the manual date on the manual? Oh, last year. It's like those kind of things, because emergencies or crises or continuity type things change all the time. And what we learn from them can change over time. It doesn't need to be in a paper manual. And we felt like we need to make an app that's at your fingertips. You can just get the information. It's always updated. You can trust it and take action right away.
Well, Hal, one thing you mentioned when we talked initially, correct me if I'm wrong on this number, but I think it was something like 3,000 people die from food safety related
Mhm.
events in a year, and a lot of them are children or younger people. And that kind of thinking about benefits that might come out of all of this, that maybe these new policies and protocol relating to COVID-19 might help us kind of alleviate some of those. Would you agree with that?
Absolutely, yeah. It is unfortunate that we still have people dying from food. I
Yeah.
think if we went to the pharmacy and got a drug and didn't know whether it might kill us or not, we'd be up in arms.
Hmm.
We say make sure those drugs are in the right bottle with the right name, and it's not going to kill us.
Hmm.
It's safe, and I think food should be safe like that too. There are thousands of deaths a year caused by foodborne illnesses. And about 60% of all the foodborne illnesses in the United States come from restaurants and retail food service by just handling food. The top 5 risk factors for causing outbreaks, which cause about 95% of all those outbreaks in the United States, are the things like personal hygiene, which are right, proper glove use, hand washing,
Hmm.
ensuring employees don't work sick, so they don't come, they're screened and don't come to work, or they're sent home when they're sick before they actually handle food. Ensuring that you don't cross-contaminate the food with foodborne pathogens, so that everything's being cleaned and sanitized. So you
Hmm.
start to hear the themes here, that
Right.
the same things that lead to outbreaks of foodborne illness in restaurants every year are pretty much the same concepts we're using now to talk about preventing COVID-19 exposure from person to person and into surfaces that can contaminate packaging and things like that. So even though the virus is not a foodborne pathogen, a lot of the controls we're actually implementing in restaurants are the same controls that can prevent foodborne illnesses. Now, certainly cooking the food to the right temperature, holding food at the right temperature, those are all critical too. But I feel really optimistic that now that the whole industry has been educated on these types of controls that are very, very effective, that all they do is just keep doing them. And I
Hmm.
think the last critical part of that to me is I'm always more concerned about if someone's doing something versus if they know they should be doing it.
Right.
Now, training is important, of course. You need to know exactly how to do things and understand the hazard and know. But to me, I really need to see, are you doing it? It's like it's great to have a measles vaccine, but if you don't actually put it in anybody, it's worthless. So you need to make sure you have a program ensuring that people are getting vaccinated with the vaccine. Otherwise, it's not a great public health intervention. And
Hmm.
so the same thing with food safety. If these controls, we know these controls can reduce these outbreaks of foodborne diseases and these deaths pretty significantly, but if they don't apply them, they won't. And so the way to know they're applying them in the past has always been a health inspection, or an FDA goes and inspects a food plant, or you might have a third-party audit firm come in and look every couple of days, a couple of months to check. That's
Hmm.
not really good enough. That's kind of oversight to kind of give accountability to the authorities. FDA is an authority and local health departments are authority, but the responsibility rests with the food service business. And so we really believe compliance at that level is critical, and they need to have compliance systems. We call these food safety management systems.
Hmm.
A book that I just wrote and finished writing that will come out probably in May that describes how to build these systems is key, because FDA just published a report last year or a year and a half ago that showed that the restaurants that had these type of systems in place had the most significant lowest risk of foodborne disease outbreaks. As a matter of fact, the risk factors that lead to outbreaks, they were lower, so much lower that the FDA recommends that these restaurants have compliance systems. These compliance systems are basically pretty simple. You've trained everybody on what to do and how to put the controls in place. You have documented that process of what the controls should be. What kind of foods are you handling? Is it sushi, or you're heating beans, or you're preparing raw chicken that can have salmonella on it? Those controls. And then you have a daily system to monitor it. So in other words, someone like a manager is monitoring how, I just saw you move over there from handling the raw chicken, and now you're over here boxing, chicken nuggets, and you didn't wash your hands. So if you don't check that and reinforce that, you're not going to see it happen, right? And so compliance systems kind of catch it before the control just becomes out of control, right? And then it puts in a corrective action immediately to say, you didn't check this chicken, it's not cooking, it's too thick. You need to make sure that you put smaller volumes of the chicken, or cut the chicken up before you cook it, things like that.
Hal, thank you very much for your time today. I think we've learned a lot of key things. What sticks out to me a bit is how important distance is in all of this, and also employee screening and disinfecting and sanitizing and all those hot topics in your app. So thank you very much for the insight. And I might ask if you have any kind of ending comments to leave us with.
Well, you guys and Datassential, am I saying that correct?
Yes.
You guys, I think we all here in our industry, and pretty much in everyone. I was talking to a friend who works for Google the other day, and she was saying, you wouldn't believe how much the doctors love telemedicine. They're actually able to do their jobs, and able to do it much more efficiently. Because why? Because instead of having to get a medical record and open up a chart and sit there and interview the patient and have a waiting room of 10 people, and not only be able to see but 10 every few hours, they've got data in front of them. They've got the patient in front of them. They can collect their vital signs right there, skip over all this kind of administrative bureaucracy, and help the patient right away. And that really is the power of data too. You guys, what you're in the business doing is providing data that can help us have actionable information to then design new products, systems, methods. That's so much important. That's so much important to not just the business model, but also in preventive models, for things like that. So I did want to say kind of a shout out to you guys, because, providing that data to the industry can be the very thing that tells them, hey, if you want your customer to come back, you need to be doing certain things that the data is showing you, and have that customer actually see that data turn into real sales. That's a really great positive thing for the industry. And of course, data analytics has always helped me figure out problems, root cause analysis. When I was looking at data, I might not be able to see it by asking someone in the restaurant, but when I see multiple pieces of data, I go, this isn't a chicken cooking problem. This is a supplier size of chicken problem.
Yeah.
That's huge. That can help the supplier. It can help the restaurant. It can help public health. So I guess thank you for the opportunity to speak to your audience and to your folks. We all are in this together. We hear that all the time. We're all business people and families, and we want to get back to work, and we want to get back into restaurants. And I think the more we talk about it and share information, even though sometimes it might be information overload in some cases, it's just nice to know there are people there. And so thank you guys for that.
Oh, well, thank you very much, Hal. I'm glad to hear that. We appreciate knowing the data is valuable, and similar to your app, it's with things kind of changing almost by the hour these days. We're updating our site with new research almost daily too. So
great resource. Thank you.
Well, thank you so much for your time today and for sharing your insights with us.
My pleasure.
All right. Thank you, Hal.